Hi guys, and welcome back. In today's video, we're going to continue on in our theme with looking at complications or side effects from various urological procedures. Over the next few videos, we're going to concentrate looking at BPH procedures and looking at the potential side effects that can occur with these. In the previous video, we looked at TURP, the most commonly performed BPH or benign enlarged prostate surgery that is performed globally, and we looked at some of the side effects or complications that can accommodate that. Today I wanted to go a little bit further and look at what is, without doubt, the most common side effect that we see from any BPH or benign enlarged prostate procedure. Before I get into what that side effect, what that complication, if you like, is, I'd like to take a step back and explain to you some of the pathophysiology, i.e. what happens as a man progresses through life and his prostate grows. For those of you new to the channel, my name is Dr. Charles Chabert. I'm a urologist and director of the prostate clinic located on the Gold Coast. As always, please like, subscribe, and always give a comment down below. Let me know what you think about what we're discussing. So if we look at the evolution that happens as a man progresses through life, gradually there is an increase in the size of the prostate. The prostate, in essence, is shaped like a donut. It sits underneath the bladder, and as the prostate grows, it causes progressive obstruction to the bladder. That can cause various symptoms, such as a slow flow, some hesitancy, the feeling that you're not quite emptied. With time, what happens is the bladder, which is a big floppy bag, it needs to squeeze harder, generate more pressure to try and evacuate urine and force that urine beyond the obstruction. If you'd like to be part of our growing community, please follow the link in the comment section down below and sign up to our free newsletter that comes out on a weekly basis, keeping you up to date with all aspects related to prostate health and various treatments that are available for men. Now back to the video. As that happens every for years, if not decades, for the majority of men, we see thickening or stiffening in the bladder wall that then results in frequency or urgency or getting up at night, which is called nocturia. Now, for the majority of men that I see in my practice, the most annoying thing that men experience is the getting up at night, the nocturia. Men find it infuriating. In fact, I spoke to a gentleman yesterday who is now getting up 5 or 6 times per night, and this was really beginning to affect his lifestyle, and he was exhausted really through the day. The other symptom that really infuriates men is intense urgency that can manifest as urge incontinence, which is the situation whereby that feeling that you're busting for a pee is so intense that some urine can come away before you make it to the toilet. So these symptoms, as you can appreciate, are bladder-related symptoms. Now, the most common side effect, if you like, that I see following any treatment for BPH, whether that's a TURP, a green light, a HOLEP, or some of the more minimally invasive procedures such as iTind or Urolift or Resume, most men experience an improvement in their flow pretty soon after a procedure. And the magnitude of that improvement and the speed with which that flow improves really is dependent upon how big the prostate is, their BPH treatment of choice, and the operator that's provided that treatment. What can catch some men unaware, if you like, is the potential for making the bladder-related symptoms worse in the short term. And what I mean by that is it's not uncommon. Around 10 to 20% of men following a BPH procedure can actually experience in the short term a decline in the way that they pee. And that is characterized by an increase in frequency and an increase in urgency. Now, as I said to you, the most annoying symptoms for the majority of men are the getting up at night and the rushing to the toilet. And the paradox of having a BPH procedure for 10 to 20% of men is that they can experience in the first few weeks that things get worse. So the frequency and the urgency can get worse before it gets better. And really what underpins that is that the bladder is no longer obstructed. And in an absence of obstruction below the bladder, the flow goes up. But if you like, there's nothing to stem the tide of resistance and the bladder still behaves in exactly the same way that it has done for a decade or two prior to the procedure. The net result is things can actually decline. The good news is that frequency and urgency always gets better following a BPH procedure as long as the bladder is adequately unobstructed. And so in my practice, the key metric for me when dealing with those men who are experiencing more frequency or more urgency is to make sure that they have no obstruction. And as long as the obstruction is treated, I know that the frequency and the urgency will settle. So although this is probably the most common side effect, if you will, that we see following any BPH-related procedure, we know that it always settles down with time. There are some lifestyle modifications that men can use, such as reducing fluid intake, moderating caffeine, both in tea and coffee, and being mindful of alcohol consumption. Those three factors of fluid intake, caffeine, and alcohol, powerful diuretics, and they can make the situation of frequency and urgency far worse in the short term. The addition beyond that is to look at bladder medication, such as Merbegron, or alternatively solifenacin, or the traditional drug, which was Ditrofan. These drugs work on the bladder to try and control things to buy men time whilst the bladder naturally recovers from their BPH procedure. As always, please let me know what you think. If you'd like to know more about prostate health and treatments, have a look at this video, or alternatively have a look at this video. Until the next time, take care of your prostate.